So I want to do a quick introduction by saying we're here at the SNMMI Theranostics meeting. And one thing that we always do at these meetings, we always like to hear a patient perspective. So this is Jud Kimmel. He is a neuroendocrine tumor patient, and I'm going to let Jud introduce himself. Can you tell us a little bit about your diagnosis and your journey?
Yeah, sure. So I was diagnosed a little over 3 years ago with stage 4, grade 3 small bowel NET. Grade 3 means it's high growth relative to NET, and I had, as the radiologist said, innumerable metastases in my mesentery and liver, as well as the primary site being my small bowel. One of the things that's kind of unique for me is that within about 3 weeks of diagnosis, I was enrolled in the NETTER-2 clinical trial, which was to receive lutetium-177 dotatate as first-line therapy. Kind of a new idea at that time, and I was lucky enough to get one of the last spots in the trial. And then a couple weeks after that, I received my first dose of radioligand therapy. So from diagnosis, getting that very scary diagnosis, to being underway receiving RLT was less than 6 weeks, excuse me. Yeah.
So one of the things that you just talked about in your talk that sort of resonated with me was that women have a lot of networks that men often deal with this kind of alone and solitary.
Yeah, thanks for asking, because it's really something I'm passionate about. So we know that men, in general, for lots of reasons, are inclined to isolate, even perhaps more than they already were, suffer shame and depression, and to actually go passive in their own medical care when they receive a cancer diagnosis. Some of it has to do with this idea that we're just supposed to suck it up, and often what that means is just repress all your emotion. And as you know, that's not a healthy thing to do, right? Things come out sideways when you do that, and with bad results. And so this group I'm involved with, called Man Up to Cancer, is all about helping guys with all types of cancers really form social and emotional connections with other guys who understand. So you're not telling a stranger, you're not telling your softball league buddy, but you're talking to a guy. They might not have the same kind of cancer as you, but they get it, right? They understand the stress, the uncertainty, the fear, the anger you might feel. And that's another thing. Guys don't know what to do with the anger and frustration around cancer, because we get a lot of messages about how you're supposed to be grateful, and that anger is a bad thing, but it's unaddressed anger that's a bad thing, right? And you need a place to howl, if you will, and to just let it out so that it doesn't become toxic. So this group is really, really important to me. It helped me personally, and if I can help other guys have a healthier relationship to their cancer and to their medical care and to their families, that's all good.
Can you talk about going through the clinical trial? What's something that you were nervous about? And how did your provider help you address that?
You know, I don't think I fully realized how nervous and the other psychological struggles I had during treatment in the clinical trial until I was midway to almost all the way through it. Actually, it's more a sort of understanding things in retrospect. One of the things I really did worry about, and I mentioned this in my session, was, well, this doesn't seem hard enough, right? You think about other people you know and love with other types of cancer, and they're having surgery and chemo and radiation and really having horrible side effects. And for me, RLT was pretty tolerable, and it was once every 8 weeks, and then you're sitting waiting for it to work. And so, you know, one thing I try to help providers understand, but also patients, is that this is the way it's supposed to work, right? RPT, RLT represents a new paradigm that we don't have to destroy your body in order to kill your cancer, which is kind of a wild idea. Yeah. So I think we just need to keep communicating that, and also help patients understand why providers think RLT is a good option for them, right? And we have more and more ways of sort of predicting a good response. And I think providers understand that, but patients sometimes don't, that there's actual reasons for this, not just because the provider thought, let's try this, if that makes sense. Yeah.
Absolutely. If you could tell providers one thing from a patient perspective,
Mhm.
what would that be?
Just because the patient says they're fine and seems fine on the surface doesn't mean they actually are fine, right? A lot of us don't want to disappoint our providers, and not out of a necessarily a paternalistic way, but just we don't want to screw things up, and so I would just encourage providers to ask open-ended questions, eliciting more than a yes or no response, really listening actively to their patients as they're talking about treatment options or about how a certain treatment's going. And if the words don't seem to jive with the mannerisms or the facial responses, then maybe there's something else going on emotionally, with fear or anxiety that the provider could dig a little deeper on and help the patient get at least a little further along to a calmer, more assured place. Yeah.
And last question, if you could kind of either dispel a myth or quell fear of someone who maybe has a diagnosis, what would you say to them?
Right. I would say really try to understand how the radiation works that's in your body after the treatment, and understand that we are getting more and more information on exactly how quickly actually that radiation leaves your body. I think a lot of people have misperceptions that they're going to be highly radioactive, for weeks after treatment, or somehow if they touch a loved one, that will actually contaminate the loved one. And as you know, it's not like that at all,
No,
right?
it doesn't happen.
But and those are maybe extreme examples, but the imagination and the might lead you to places, and also the fact that it's still relatively new
Yeah.
in the grand scheme of things. And so I would just really encourage patients to understand that yes, it is nuclear, it's radioactive, but the speed at which most of that radiation leaves your body might surprise them, and that would hopefully give them some confidence.
Yeah.